In addition to what Dr. Wiles commented on about the safety of acute and how it's different than a typical medical surgical hospital, that it's so contained and it's its own unit, etc. All of the treatment up here, as people I think well know, is room-based. And so the patients rarely are out of their rooms except to do some minimal laps around the unit and for other perhaps appointments that they have on the unit, but really they're in their room, and so there isn't mingling. We also essentially have no groups on our unit in contradistinction to traditional eating disorder programs. And so again, there's this isolation, this social distancing, which is so crucial to preventing spread of this infection. Furthermore, all of our patients have their own locked bathroom in their room, and so there isn't sharing of any bathrooms as one might see in other centers. And again, this is not to deprecate the work of residential treatment centers, but just to point out the differentiators of why acute is so unique and why it really is a resource for the country for those patients who need a higher level of care because of the extreme forms of their eating disorders. As we know, unfortunately, despite a lot of good efforts in this field and good work that's going on to try to successfully treat people that are beset with eating disorders, unfortunately, anorexia nervosa continues to have the highest mortality rate of any psychiatric disorder except for perhaps the opioid epidemic. And thus, when someone is at a body weight that is so low that they meet the typical acute criteria for admission, or they have major electrolyte and acid-base abnormalities, which acute is world-renowned for treating, or they have other medical comorbidities but aren't getting good treatment for them, those people really need to weigh the risks of coming to Denver Acute versus ongoing delay. I would opine that this is a tough and perilous disease and one that shouldn't delay. We know that the lower the BMI falls, the greater the mortality rate for these patients, and these complications can be tough, and if they're not taken care of, these patients will end up in a medical surgical hospital in their community, and then you have more exposure to potentially COVID, and you have physicians and staff that aren't familiar with them. So I think it's very prudent to make the decision that not to delay your treatment if you truly have an extreme form of the eating disorder, and to contact Acute's intake folks in order to make an appointment with them to further review your case and hopefully get authorized to admit to our service here. As we all know, unfortunately, the dynamic state of the COVID epidemic in the United States is overwhelming right now, and we're rapidly running out of ICU beds in America and other protective advices and ancillary services that we need to care for these critically ill patients. So as med-surg hospitals who may hear this, if you have patients that have been languishing in your hospitals for many days with significant anorexia nervosa, we can help. We have an air ambulance service that would pick the patient up at your hospital and bring them directly to acute called Angel MedFlight that we've used for many years to transport our critically ill patients, and it will thus free up critically needed beds in order that you can better deal with the surge that is likely to come until we get ahead of this pan-epidemic.